Good evening everyone. My name's James. I'm the Strategy Director for Leeds Teaching Hospitals, and I'm really thrilled to be here. Slightly nervous because I'm definitely not a digital native. In fact, I've only recently learned how to pay for things on my phone because one of my team members shamed me into it. When Pad first got in touch about the Leeds Digital Health Network, I was really keen to be involved and support. And I suppose picking up on some of the themes that Rich has already touched on, networks and collaboration are really the lifeblood of innovation. So where people have diverse networks, the evidence suggests that they are better at novel idea generation. And that's what we need to solve many of the challenges that we face in health and care services. So really fantastic to be here this evening at BJSS. And I think Leeds has got a good claim to be the digital engine of the NHS. BJSS redeveloped the NHS spine, which is the connecting architecture for pretty much everything that goes on in the NHS. AirLogic and other partners, I don't know if there's anyone from AirLogic here, but they're our electronic patient record partner. So they develop PPM Plus with us, which is an interoperable, I suppose, system of systems, supports all the patient care, not only in Leeds Teaching Hospitals, but also the foundation for the Leeds Care record. So there's some fantastic digital health talent in Leeds, and no doubt in this room. So it's brilliant to be here this evening and think about how do we take that forward? How can we create the community ethos of sharing and learning together that Rich has just described? And in the city, we've got a really strong vision about how we drive forward innovation through the Leeds Innovation Arc, which is an economic and spatial policy for the city centre, stretching from the area that we're in now up through to the Leeds General Infirmary, where we're going to be building 2 new hospitals between now and 2030, and to the university campuses. And how can we create the spaces and connectivity and programming and communities that support innovation in some of our key industries, but importantly, innovation that's going to help us to solve societal challenges here in Leeds, but that are globally relevant. So health tech, as Rich has said, is a fantastic strength in Leeds. 1 in 5 jobs in the UK in digital health are based in the city. We've got over 200 medical technology businesses based in the region, and most of their products now are integrated between medical and digital technology, which is something I'll come back to. I wanted to reflect, therefore, on how do we match up what's possible with what's needed, and I think that's a real challenge for collaboration between the NHS and industry partners. And so I thought I'd offer a few reflections on what's needed, what are some of the key challenges that the health and care system is facing in Leeds, but also globally, that digital can help to unlock. So I think the first thing is how can we meet the needs of our population? And those needs are changing. We've got a diverse population, but we're seeing significant increase in long-term conditions and multimorbidity, and that's creating demand on the healthcare system that in reality we're finding it difficult to serve. And so we need to think about new models of clinical delivery, and they can be supported by digital technologies. So let's think about a couple of examples. I met a company earlier this week who were developing an app to help the monitoring of progression of Parkinson's disease. Parkinson's is a neurodegenerative disease. It's a long-term condition. Once you've got it, it gets worse over time. And from a clinical caseload perspective, that means that our caseload is growing exponentially because you've got compound growth. And so we need to look at new ways to deliver that clinical service, the interaction between the doctors, scientists, nurses, other clinical professionals in the hospital and the patients who need their care. What this app does is it takes 10 years of research into how you monitor and establish the progression of someone's Parkinson's, and uses digital tools on your phone to make those assessments more regularly from home, so that we can then stratify the patients that we need to see in the hospital. I think what's important about that is that it's based on clinical evidence over a 10-year period, and something that I'm sure you'll come back to at future Networks events is how does the digital industry interact with the kind of clinical research community to generate that evidence and to inform the products that no doubt many of you are working on. The second challenge, I think, is around workforce scarcity. We're not training enough health and care professionals worldwide, and therefore we need different ways of providing health and care that allow us to scale our offering, and I think that's an area that digital can undoubtedly help in. Some examples from Leeds teaching hospitals. We've recently implemented a patient hub which allows anyone to change their hospital appointments and to manage that much more effectively. But when we're thinking about new systems, we can't just layer on top of the existing model, and some of the early evidence that came out of the United States with electronic patient records is that actually clinicians were mainly accessing them at evenings and weekends, and it was contributing to clinician burnout. So digital products need to be implemented in a way that integrates them with the model of service delivery, and I'm sure many of you work on kind of user interface design, and you're actively thinking about how to involve clinicians, patients and members of the public in the design of new digital products and services. I think the scale that digital offers also offers massive benefits in terms of the training and education of healthcare professionals. And there's some really exciting work coming out of the University of Leeds at the moment around virtual clinical experiences that allows us to stream clinical consultations, some of the diagnostic information that's present, and things like room views to medical students, both undergraduate medical students and postgraduate medical trainees. And that training placement capacity is a real constraint on being able to get new doctors through. So we're really excited about the application of that in Leeds, but also it has potential application in the kind of global south to help support the training and education of clinical professionals worldwide. Another challenge that we face is our legacy infrastructure and the complexity of existing systems in healthcare. So I'm slightly stealing one of the jokes of our Chief Digital Officer, but our network's over 20 years old, so the SPI skills were at the top of the charts when our network was implemented. We're replacing it starting this year and over a period of a number of years, but that doesn't make for robust infrastructure to layer digital products and services and clinical delivery on top of, and that's just one example. We also have a huge number of systems in the hospital, somewhere over 800. So that's managing that brings a significant degree of complexity, and we need to bring that number down over time. And indeed, the interoperability and integration with partners is a real key opportunity for us. So, coming back to the Leeds Innovation Arc and our innovation vision, we're planning 2 new hospitals on the site of the Leeds General Infirmary, and it was really exciting today to have the Secretary of State stand up in Parliament and confirm that those hospitals will be delivered between now and 2030. And we need them to be digital by design, both in terms of the underpinning infrastructure, the kind of data architecture, and we're just in the midst of implementing a new data platform, which will bring in things like building information management systems, a live bed state, helping us to manage patient flow more effectively in the hospital. And then in terms of managing the patient experience and also integrating with our partners, and how can we deliver care, really a hospital without walls. So how can we provide access to the clinical expertise in the hospital from outside the hospital? And I can see Adrian from Ateco Health, who are one of the companies that we work with to do that here this evening. So it's really exciting that the kind of promise around virtual wards is hugely exciting. And I suppose, how do we create those connections with industry partners, with academic partners? Well, through an initiative called the Innovation Pop-Up, which is really, I suppose, trying to stimulate communities like this, but within the hospital, creating a permeable boundary with the hospital, trying to help do innovation on the inside of the NHS firewall, and really helping us to test out some of the technologies that we want to apply in the design of the new hospital, but also try and build a track record of credibility and collaboration with partners ahead of us bringing forward the redevelopment of our site. So I've probably gone on long enough. But really excited to be here this evening and to see where this community goes, and fantastic to see so many of you here, and just encourage you to connect with colleagues tonight and at future events, because that's where those kind of innovations, new ideas, product services will come from. Thank you.